Hi, I'm Beth Battolino, CEO of Healthy Women. Thank you for joining us today on Healthy Women's first talk show, WomenTalk. Hello and welcome to Women Talk. I'm Beth Battolino, CEO of Healthy Women and your host of Women Talk. We've got an extraordinary and an important episode planned for you in honor of American Heart Month. Together with the National Heart, Lung, and Blood Institute, which is part of the National Institute of Health and is part of the Heart Truth program, we are encouraging women to take action to protect their heart health. Today's discussion will help women understand what their heart health numbers mean, risk factors for heart disease, and the practical steps that they can take to protect their heart health. We'll also look at some of the importance of self-care, stress management, and social support. And there's no better guest with whom to have this conversation than with Dr. Gina Wei. Dr. Wei is the Senior Scientific Advisor on Women's Health and an Associate Director of the Division of Cardiovascular Sciences at NHLBI. She also directs the Division of Cardiovascular Science Prevention and Population Sciences, which funds and provides leadership for populations and clinic-based research on the causes, prevention, and the clinical care of heart, lung, blood, and sleep disorders. Dr. Wei, thank you so much for all the work in women's health and for being here today.
Thank you, Beth, for having me on Women Talk to really highlight this important topic today.
It is important. And so my first question to you is, Dr. Wei, why is it so important for us to have this discussion about heart health for women?
It is so important because heart disease is the leading cause of death in the United States for both men and women. So let me give you some statistics here. So more than 17 million in the US have coronary heart disease, which is the most common form of heart disease. And more than 375,000 people died from coronary heart disease in 2021. Yet research has shown that the awareness of this fact, the fact that heart disease is the leading cause of death among women, have actually declined, especially among younger women. And this is very concerning when in fact heart attack rates are actually rising in young women. So really, we really want to raise awareness and get the word out to everyone that heart disease is largely preventable and that it's important to know your personal risk factors so that you can take action to control them.
My next question is, can you tell me, Dr. Wei, what is coronary heart disease?
Coronary heart disease is a type of heart disease where the arteries of the heart cannot deliver enough oxygen-rich blood to the heart.
And what factors contribute to coronary heart disease in women? What are some of the factors?
Many factors for heart disease or coronary heart disease are actually the same as for men, including high blood pressure, high blood sugar or cholesterol, poor diet, being sedentary or overweight, smoking, and poor sleep. And having multiple risk factors significantly increases a woman's chance of developing coronary heart disease. But let me mention that there are also other factors that are unique to women, such as conditions that can occur during pregnancy, like gestational diabetes, gestational hypertension, and preeclampsia, which is a serious type of hypertension during pregnancy or shortly after delivery. And in terms of the frequency of the overall risk factors, about 3/4 of women aged 40 to 60 have one or more of these risk factors for coronary heart disease. And even in younger women, we're seeing the rising rates of obesity and diabetes. Again, the important thing to remember is that coronary heart disease is largely preventable.
So thank you so much for that great response. My next question is, why is it important for us to keep your heart healthy during pregnancy?
Yes, indeed. Heart health is especially important to maternal health. Cardiovascular conditions are the leading causes of death during pregnancy or childbirth as well. So these causes of death include developing heart disease heart muscle disease like cardiomyopathy, blood clots, high blood pressure, stroke, and a category that combines all the cardiac conditions. Really, during pregnancy, our heart works harder than usual. So that is why it's important to keep ours healthy. Pregnant women should know their blood pressure numbers and their blood sugar numbers and be able to work with their healthcare providers to keep these under control. If I may talk a little bit about preeclampsia, if
I would
that's all
love to
right.
have you dive a little bit more into preeclampsia.
Yeah, it's important to raise awareness on that. So preeclampsia, as I said, is a serious type of high blood pressure that develops during pregnancy. And actually, for some people, it could even develop up to the first weeks after pregnancy. And it can really have serious immediate complications, can lead to seizures, stroke, and even death. I want to encourage all women who are pregnant and who also who's given delivery to really watch out for warning signs of preeclampsia. And that include worsening headaches, overwhelming tiredness, dizziness, trouble breathing, nausea, chest or belly pain, or just sudden swelling, especially in your face or your hands. Tell your doctor immediately so you can be evaluated and treated. And the other thing to say about preeclampsia is that once you develop preeclampsia, and let's say you treat it, you're fine, your baby's fine, everything's great, but realize that it could increase your risk of heart disease later in life. So if you've ever had that diagnosis, even if you don't plan to become pregnant again, please do share that information with your healthcare provider. Talk to them so you can have your blood pressure and other cardiovascular risk factors measured more closely.
I think that's such an important piece of information that we're sharing now. So, again, for those that are listening, if you recently had a baby and you were preeclamptic, the importance of sharing that information with your primary care after baby is so important because your risk of heart disease can go up because you had preeclampsia. And the chances of getting preeclampsia again with your second baby, if you decide to have more, will also go up. So making sure that you flag that if you have a new OBGYN or primary care is also important. So thank you for sharing that.
Yep.
So the next question I have for you is I'd love to hear a little bit more about the Heart Truth program and the focus for American Heart Month for 2024.
Yes, happy to talk about this very important program. The Heart Truth program was created by our institute, the National Heart, Lung, and Blood Institute, or we call it NHLBI for sure. And it just rolls off my tongue, right? NHLBI. But it's important, but this program is so important, is to really trying to raise awareness about heart disease and encourage people to live heart healthy lifestyle. As I said earlier, coronary heart disease is largely preventable. So we want to get the message out and to really raise awareness so we can empower everyone, including women, to take action. And so this year, the program is focusing on efforts to improve heart health literacy, meaning we want people to know and understand what their risk factors for heart disease are. And really, we are again encouraging people to take action to protect their hearts. And I also want to mention that understanding risk factors is one important step. And at the same time, you have to know what your risk factors are. So please go to your healthcare provider and find that out and talk to your healthcare provider so collectively you can manage those risk factors together.
I have to say, Dr. Way, we here at Healthy Women are huge fans of the Heart Truth program and just so excited to continue to promote and draw awareness to that amazing program. The next question I have for you is can you talk about why it's important for women to understand what their numbers mean?
Yes, I know we throw that term around sometimes,
Right?
and we really need to explain that. So thank you for that question. So when we say understand your numbers, we mean for women to find out about their personal risk factors for heart disease. And again, that enables us to be more proactive about maintaining a heart healthy lifestyle and to really have behaviors, reduce the misbehaviors, if you will, that cause heart disease. So a part of that, we want to promote health literacy, as I mentioned. And so by knowing your numbers, this is what we mean. We mean have your healthcare provider tell you what your blood pressure level is, have your blood cholesterol checked, and also your blood sugar is checked and know those numbers, and as well as your weight. So you want to know what their numbers are, and also you want to ask your healthcare provider about what's the healthy range, or also what kind of goals that you can work together towards that range, and then be able to act on that. So again, those numbers I said is know your blood pressure, your cholesterol, your blood sugar, and your weight.
That's great advice, and just so important. And that's really, when we think about the risk factors that can increase a woman's risk for heart disease, those are basically the same, right? The understanding your numbers, family history, weight is important. All of those can affect a woman's risk for heart disease, and whether or not you're preeclamptic. If you had preeclampsia, that could also affect your risk for heart disease.
Yes, indeed. Well said. That's a great summary.
So, lifestyle changes. What can women do to help improve their heart health? What are three things that we can do right now that would help improve our heart health?
Yes, and I love what you're saying about things we can do right now. And so we want to say that the changes, although we like them to be big changes, don't have to be big changes. They can be small changes,
I love
right? And small changes, if you do it on a daily basis, can become routines and become health habits and have long-term health benefits. So here's three things that we all can do, I think, and I know I've been trying to do these as well. So number one is finding ways to add more physical activity into your day. And that could be as simple as parking your car a little bit farther when you go shopping next time. So you have to walk a little further. And take the stairs instead of elevators when you need to go up or down a few flights. So again, that's physical activity. The second thing is our diet, right? We all know we need to have a healthy diet. But for us, if you could just add a serving of fruit or a vegetable, an extra serving of fruit or vegetable to your day, call that a win, and then build on that. And the third thing is stress. We can't avoid stress, of course. Sometimes they come our way, but hopefully we can do our best to try to de-stress. And whatever works for you, hanging out with your good friends. For some people, it's meditation or prayer. Just some time for self-care. So again, it's physical activity. Add a little bit more. Add a little bit more as extra serving of fruit or vegetables to your diet, and taking time to distress. So there are other ones, but those are the three that I'll
I love
mention
those
today.
three. And there's, again, super easy to just do to add into your, daily living routine. Parking your car a little bit further and walking, meditation, or, prayer, and just, eating better is just also important and honestly really easy to implement. So I love anything that's easy. I love that. Um, how can our listeners learn more about the Heart Truth Program and the American Heart Month 2024?
Yes, follow the Heart Truth channel on social media. We have a website, hearttruth.gov, that has plenty of resources and tips. Again, we just want to emphasize that you're never too old, you're never too young to start focusing on your heart, and also learn more about heart health, improve your health literacy. So yeah, so that's it. And the resources are available for download, and many are also available for order free hard copies. But we have a lot of rich resources that we want to help all the listeners or the viewers to take small steps but big changes to your life.
I love that, Dr. Wade. Thank you all for tuning in to such an important conversation. And Dr. Wade, thank you again for taking time out of your busy schedule to offer some important heart health tips. For more information on this topic and to get the links to this great information from NIH, NHLBI, please visit healthywomen.org or hearttruth.gov. And thank you again for joining us today, and tune in here for the next episode of Women Talk.
Thanks again for joining us on Women Talk. Don't forget to follow us on social and visit our website at www.healthywomen.org.